everyone, welcome to the very first episode of the Infertility Files. I am your host Dr.Saloni Gandhi, Associate Doctor and Fertility Specialist at Gynac World. Today we have Dr. Duru Shah with us. She is a woman who needs no introduction in the field of women's health. She is one of the most respected voices in reproductive endocrinology. Something you must know about her is that she started in an era where there were no ultrasonographies available or advanced hormonal assays available either. So ma'am, how do you think that shift has been for you? Do you think that it has helped us or has made any drawbacks to the coming clinicians?
I mean, if I tell you how we started by just listening to the patient, listening to her complaints, listening to her misery, what she's undergoing at home. And then of course the history taking started as to what are your problems, how are your periods, how is your marital life, is there any sexual dysfunction, etc., etc. Because we understand that a woman gets pregnant only when everything is okay with both the partners. So in short, we talked about clinical examination, looked for any discharge from the breast, we looked for any abnormalities on the skin, we looked at the vaginal area, looked at whether there is any infection. We examined the patient actually bimanually, looked for cyst in the ovary. We were very good at clinical judgment because we had nothing to sort of tell us that this is the problem. So that's a sharp contrast from what happened earlier, where we depended only on our clinical skills, and what happens today when a patient comes to us with multiple reports, and most of the clinicians tend to only look at the reports and make up their mind about how to manage the patient. I think that's been the basic difference between the 1970s and the 2020s, 50 years.
So ma'am, do you think it has created unnecessary anxiety in the patient today?
I think the anxiety comes because they are reading a lot of social media. There's such a big hype. They are talking about all kinds of investigations. They are talking about kind of food they can eat, kind of exercise they can do, which is not necessarily from the experts. It is basically different platforms dumping all the material they want to dump in just to get some kind of visibility. So I think it's the anxiety comes more from reading not the right stuff, but I would rather they see the doctor and get hold of what all is going on, rather than depending only on what they read in the magazines or on social media.
So ma'am, that is what the whole conversation today is going to be about. We wanted to know when it is the right time for a couple to start looking into a visit at a fertility clinic or consult a gynecologist for the same. Because today everybody is reading things online, like you said, and people have realized that everywhere online it's saying, the Western guidelines are suggesting that if you are under the age of 35, you can try naturally for a year. Is that true for the Indian population as well, ma'am?
I think there are a lot of cultural differences between the Indian population, the European population, different cultures. In India, what we have found is that menopause occurs around the age of 46 to 47, maybe 48 years. And about 10 years prior to menopause, the ovaries start sort of failing. So in short, not that they fail completely, but their function or the egg quality gets affected about 10 years prior to menopause. So in short, if a woman is to reach menopause at 48, by 38 her eggs have gone for a toss. So in short, what we recommend to our women is that if you are not yet planning a baby, at least till you are 33 years of age, or if you have not yet been married, or you are not thinking of even having a baby on your own, then we tell them that you must look at possibilities of what is happening to your reproductive system. If you are very keen that you need to use your own eggs because you don't want the eggs to be poor quality by the time you have a baby, in that case we tell them that by the age of 33, if you have not conceived naturally, even after trying for a year, not being married for a year, but after having tried without a contraceptive for a year. And if you haven't conceived, then it's the right time for you to go to the doctor and determine what's wrong, why aren't you conceiving. I think that is what is important. Age is a factor, which is an extremely important factor, rather than the various tests which people are doing today.
So, we've established that for Indian population 33 years is probably a cutoff. However, we come across a lot of patients who probably need care earlier. Can you enlighten us about that as well? Like, when do I know that even though I'm not 33, I should be consulting a doctor sooner than later?
I totally agree with you on that, because there are certain disorders which immediately will tell you that this lady may have a problem. So, in short, if she's got history of endometriosis, if she knows that she has endometriosis, if she knows that she has polycystic ovaries with erratic periods, if she knows that she's had a condition like tuberculosis in the past, if she knows that there is a genetic disorder in the family wherein her mother reached premature menopause, menopause at a very early age. So, situations like this, wherein she is aware that there is a certain problem which may need attention, those are the women who should go to the doctor even before they get pregnant and even before they are planning a pregnancy, because then the right thing can be done at the right time. We do not want them pregnancy when their hormones are all over the place. We do not want them pregnant if they have got a heart disease, because they need to be corrected before they get pregnant.
So, Dr. Shah, can you please tell me, see, a lot of patients that come to our clinic are usually very scared. They feel that if they are coming into a clinic, they are going to be forced into IVF, because now the trend has become very pro IVF. So, what do you think about it, ma'am?
I think women should not be worried about what treatment they would get, because every woman's treatment is customized, and IVF is usually the last resort. It is never the first treatment plan unless there is a reason for it. Say for example, a woman has come to me with blocked tubes. She's undergone tubectomy, she's closed her tubes, she's been sterilized, and she's lost the only child which she had, and now she wants a baby. So, I know that when her fallopian tubes are blocked, there is no way she can get pregnant, because IVF started this way. It started with a woman who had blocked tubes, and therefore, there was no way the egg and the sperm could meet. So, the concern was, how do we make them meet? Where the man is concerned, it is very easy for him to give the sperm, but for a woman, it is for getting her eggs out of her pelvis, and therefore, that is never the first choice. So, in women who have had blocked tubes, or there is a reason for us to go ahead with an IVF, especially say if a male has got hardly any sperms in his semen, but he has got sperms in his testes, we can still do treatment for them, but they will require IVF. So, in short, we start usually with very simple treatments. We try and determine what is the cause of the problem, why is she not getting pregnant, is there a hormonal problem, is there a problem with the sexual activity, is there a problem with a disorder which she may be having, is it just simple vaginal infection. It can be simple things. We correct the problems, we make sure everything is okay, and then we go with a routine treatment of timing their ovulation, when is the egg being released. We may monitor it through urinary LH kits, or we may monitor it through ultrasound. We determine when she is ovulating, how is the quality of her egg which is coming out, when is she timing the intercourse. So many myths are there. So, in short, we help them with timing either normal intercourse, or if needed, then we add on an intrauterine insemination, wherein we take the partner's semen, wash it, clean it, and put the good sperms inside. So, that is assisting fertility in a very simple way. But if in spite of that, if she is not conceiving, then we have to look at the option of either offering her IVF or seeing whether we have missed anything which we have not yet corrected. So, it is a situation sometimes of unexplained infertility, where everything is normal. You have tried your best, you have done timed intercourse, you have done IUI and still not conceiving, at least 3 to 4 cycles of IUI which everything is good and still she is not conceiving, then yes, she needs an IVF. So, it is not IVF first, it is IVF last.
So, ma'am, basically anytime a patient or a couple comes to us, we would want to evaluate them further. If after evaluation we have decided what the fertility factors are, what is the problem that is causing the infertility, and based on that we select either simpler methods like IUI or ovulation induction, or if it is absolutely indicated in those patients, we go for IVF. That is exactly what you are trying to tell us, right?
Absolutely.
Ma'am, now a lot of patients come and tell us that I am not mentally prepared, I am not mentally prepared. So, they end up wasting a lot of time there. So, ma'am, what do you think? Should they still be going into IVF when they are half-heartedly there, or do we wait for the right time, or how does that work, ma'am?
See, there is never a right time. You know, after all, it is a human body, and we know that the quality of the eggs will start deteriorating, and it is not necessary also that it happens only at 33 or 35 or 37. It is different in different women. So, we calculate their ovarian reserve besides their age into practice. We also look at the ovarian reserve, which is a test, some test we do, which are to assess whether what are the number of eggs inside the ovaries, what is the quality of those eggs, and therefore, then make a decision as to how soon she needs an IVF. Now, even if she is not prepared to get pregnant at that age, there are many women today who are in careers and are not wanting a pregnancy at the time when they are reaching the peak,
Yes.
and therefore, they want to postpone their pregnancy. Now, in that case, we can't let them go naturally, because the biological eggs are sort of maturing faster. So, in short, what we do is we tell them, okay, freeze your eggs, save them aside, this is like an insurance plan for you. If you do not conceive later with your own eggs, then you can always use these ever young eggs which will help you to get pregnant faster. So, that is the only condition wherein we may want to do an IVF for her, because freezing the eggs, we need the eggs out of the body to freeze them.
Dr. Shah, it is very empowering to know that we have somebody who can guide us when is the right time to select what kind of treatment. The only thing is that you need to visit the right clinic and the right doctor to help you through the journey of parenthood. So, Dr. Shah, let's now break some myths. I'll state some myths or facts, and you can let us know if it's false or incorrect, and if it needs an explanation, you can enlighten us a little more. So, the first one is going to be, it is only when I have exhausted all pills, IUIs, multiple extensive follicular studies, that is when I look towards IVF. Is that correct?
It's totally incorrect, because I think I've already explained it to you that it matters with every patient, and the question or what you mentioned is wrong.
Okay, ma'am. The next one is going to be IVF has 100% result.
Again wrong. 100% results no one can guarantee in this world. I mean, even in a natural, in a patient who's trying for almost a year, right, month after month, there's no guarantee that she'll get pregnant, right? We wait for a year to say whether she will get pregnant, and the chances of pregnancy per month, by the way, are only 7%. Yes. So, how can an IVF cycle give you 100% at the first shot? Not possible.
So, the next one is that you fix the women first and then you screen for the men. Is that correct?
Again wrong. I think there are too many wrongs happening here. So, the question is that to make a baby, the husband and the partners have to be absolutely, both have to be normal. There have been times I have come across women who have come to me who have been taking treatment for the last maybe 8 years, 9 years, and they have been told that nothing is going to happen, now leave it to God. So, then when they have come to me, I ask for the semen report, it's never done. It's not done. So, when I did the semen report, I find it 0 sperms. How is she going to get pregnant? So, in short, a woman must never waste time, or a clinic or a doctor must not waste time evaluating only the woman first. Both need to be investigated simultaneously. because it takes time to correct both of them their disorders. And today, since women are reaching us much later in life, they are not young at 22, 23 getting pregnant, right? They are still working, they are still having their careers. So, in short, what we need to do is, when they come to us, evaluate both simultaneously, so that you know where to start working and how to proceed. I think that's the best way.
Okay, all my hormones are haywire, but I am going to get a very good result with IVF. Is that correct as well?
No. So many of our patients, especially the ones with PCOS, we find that their hormones are not in the right place. Their male hormone may be high, the insulin may be high, the sugars may be high. There are so many factors. The thyroid may not be corrected. So, even if we just correct that and we get her to follow that ovulation protocol, I mean, they get pregnant on their own. We do not even need to give them medication, we do not need to do anything except correcting their hormones, of course, through medication. But there are many women who are overweight or they are actually obese, in which case we need to correct that also, because it is a well known fact that if you lose just 5 to 10% of your weight, the chances of pregnancy increase by 25%. So, in short, that is another thing we need to do.
I know our listeners must be totally empowered today to know that IVF is not a failure. It is a tool that we can use to reach parenthood earlier in cases which are indicated. So, the whole point is not the journey to parenthood, but the end result. So, ultimately you are going to have a family that you are looking forward to. So, I think that is okay, right?
Yes. Yeah, I think so. It is exactly right what you are saying, that it is a journey, and the journey goes along with the patient, the doctor, the patient and the team. Everyone together is on that journey, and it is a very pleasant journey, because each one is talking to the other, each one is understanding the other person, and at the end of it you have a successful pregnancy, which gives more joy even to us as doctors rather than the patients. I think all of us are so happy when the woman gets pregnant.
Yes, ma'am, I am sure, because I think those patients can never forget the person who helped them reach this dream of theirs to complete a family, right?
Absolutely. Even if I meet them 20 years later, they introduce their young man to me or their beautiful daughter to me, and it's really wonderful. In short, it's a moment of joy, and we all celebrate, and we always wish that we could help many more women similarly, so that we could give that joy to everyone in the world.
So, in our next episode, we are going to cover the hottest topic of the hour, that is AMH. We will see you in the next episode. Till then, you can write to us at our Instagram handle @gynacworldonline, or email us at gynacworldfertility@gmail.com. Thank you so much, ma'am, for sharing your valuable knowledge today. Till then, have a good time.